So I'm introducing Trevor Hancock, who is speaking at the Population Health Congress in Tasmania and who has been part of the keynote plenary on grand challenges and wicked problems. So you talked, Trevor, about the ecological blindness that we've seen in public and population health. Can you tell us about that?
Well, if you go back and look at the early work on the determinants of health, which really came out of the population health program at the Canadian Institute for Advanced Research, their first book, which came out in the early 90s on why are some people healthy and others not, if you look through that book, you find no reference to ecology, ecosystems. It's not in the index, there's no section on it. So right from the beginning, although they were talking about the determinants of health, they didn't include the earth, the ecosystem services, air, water, food, energy, fuel, materials, all of that we get from nature and that actually underpin our society and underpin our own well-being. So several of us at the time talked about it as being ecologically blind. So it was very, if you like, it had one eye open. It had one eye open to the social side, but was blind to the ecological side.
How do public health people defend themselves on that ground to you?
Well, I don't think they exactly did. I think the people who put together that that way of thinking came largely out of the social sciences, and so that was their route and that was their worldview. I think that maybe we failed adequately to put forward why the ecology or the ecosystem should be a piece of it, but for whatever reason, in fact, if you look at what happened, the determinants of health became the social determinants of health. So when WHO did a commission, it was on the social determinants. It really wasn't dealing with the full range of determinants. Nothing wrong with that. I mean, I'm not trying to undermine the social determinants. Of course, they're important. The problem is if you only see those, you miss half the picture.
And by missing half the picture, what are we missing in terms of health and health systems?
Well, what we're missing is that our current economic and social system is driving global ecological change, not just climate change, but loss of species, loss of biodiversity, mass extinctions. We're at the beginning, for example, and into a sixth great extinction. There have been 5 previous great extinctions caused by, the most recent one was a meteor that is believed to have triggered the extinction of the dinosaurs 65 million years ago. The difference, of course, is that this is a great extinction that we are causing because we're destroying habitat, we're eliminating species, not just the big things like lions and elephants and so on, but lots of small species too. So there's that. There is loss of resources, particularly soil, water, fossil fuels themselves, which are a finite resource. And we shouldn't just be burning them and getting rid of them because we'll never have them again, and so on. Certainly fisheries, forests that were using most of those resources at non-sustainable rates. And then the third big category, or fourth really, is pollution and ecotoxicity. So we are generating massive levels of pollution, and in particular we're poisoning the entire ecosystem with persistent organic pollutants and to some extent heavy metals. So you put all of that together and that constitutes global ecological change. The health implications run from shifts in fertility due to persistent organic pollutants and other contaminants, not just in human species but in other species. When you start to acidify the oceans, when you start to change the oceans due to climate change, you undermine the food chain in the oceans. When you deplete the forests and the soils, you're depleting the basis of our agroecosystems and our wildlife systems. And so it goes on. And all of those have massive health implications. So in addition to climate change, there's all of these other things going on.
So before we get on to solutions, just one more around that. Where do Indigenous people and knowledges fit within that, an ecological view, an ecological determinant?
Well, it's interesting you should ask that. I was just having a conversation with one of the other plenary speakers and a couple of his colleagues, and he is Aboriginal in part, and he talked about that. That was his presentation was around STIs in Aboriginal communities, and when we look at this, I come from British Columbia, and in British Columbia 10% of our population is Aboriginal, and they've become very strong and very powerful, particularly around these environmental issues. And they have this perspective. If you look at, I've done work with Aboriginal communities, with First Nations people as we call them, around indicators of well-being. And the fundamentals of well-being that Aboriginal people talk about is land and culture. And so the land is fundamental to their well-being and in their lives. And so in our report, we talk about one of the signs of hope is, if you like, a rebirth or a re-understanding of that notion of connection to the land. And Indigenous cultures have that. And so there's much that we can learn from, and that's one of the sources of hope, because we're beginning to make those connections, and they're beginning to have a powerful economic and political voice. They can block development in various ways in BC, which is a very good thing.
Should they be more than just sort of consulted, though, about this? Should Indigenous understandings actually be embedded in ecological determinants theories?
Oh, absolutely. And I think that it's not even, we see it now in Indigenous people, but of course, you know, I'm European in origin. But if you go back thousands of years in Europe, those were the beliefs that were there before the Christian era, before a lot of that, the connection to nature was very powerful and strong then too. So it's more something we've forgotten, not just in Indigenous people, but in all of our cultures. The difference, of course, is that Indigenous people have not forgotten it. And so it's very strong there. So it gives us something to build from.
Okay, so the fact of you being here, does that tell us the blinkers are off in public and population health now about your messages? And if they are or aren't, you know, what should people be doing?
Well, I think the blinkers are coming off, or the blinker, the one eye is opening, the second eye. And I think that's because the crisis is becoming more obvious. Climate change is not theoretical any longer, it's there. Species extinction is there. All of the different measures tell us that we're in crisis or heading into crisis. And so that message is getting through, and population health is responding to public health. And so when we talk in our book, well, it's not really a book, I should say, it's a report. So we did a report for the Canadian Public Health Association on the ecological determinants of health, which is now available on the CPHA website. You can look it up for yourselves.
That's its title, yeah?
It's called Global Change in Public Health, and it looks at, and the subtitle is about the ecological determinants of health. So either will find it. It was released in May of 2015, and in that we have a section on imagining the future. So we lay out the usual litany of bad news, because we believe it's rather like having cancer or a chronic disease. You don't deal with that by ignoring it and hoping it will go away. Yeah. We don't think it's good for our patients to just say, oh no, I'm not going to talk about the cancer I have, and I'm not going to do anything about it. That's crazy, and we don't think it's smart. So it's the same at a global scale. And so you have to look at what's happening, and it's not pretty. But then we have a section on imagining the future. So, okay, this is not looking good. Let's imagine what it could and should be like. And then we have a chapter on hope. What are some of the sources for hope? So it's things such as the Indigenous perspective is there, and we can rediscover it and reincorporate it. But it's also things like, we've done this before. If you were in Manchester in 1850 and looked around, it looked like the end of the world. It was horrendous in terms of air pollution, water pollution, lousy jobs. Life expectancy for the labouring classes in that part of England in that period was about 17 years, 17. It's astounding.
Yes.
And because of massively high infant mortality rates, 250 per 1,000, 25% of all babies didn't make it past 1 year of age, that sort of thing, because of the appalling conditions. Well, we changed that, and public health was part of changing that, along with social and political reform and all sorts of other reform movements, engineering and so on. So we've done that before. We've done it around tobacco more recently. We've changed the social norm around tobacco. You probably 30 or 40 years ago would have had people smoking here. You'd have had ashtrays on the table or in the meeting rooms. You wouldn't dream of doing that now, and that's been public health that's done that, and its allies. So there's all sorts of reasons for hope. We know what we need to be doing. I commented that, you know, nothing that we're really talking about doing now is new. We actually knew it all 40 years ago. We've lost 40 years. We didn't implement what we knew. And we have a more sophisticated understanding and some technological developments and all the rest of it. But basically, we knew what to do then. We still know what to do. So it's not a matter of we don't know what to do. We do know what to do. That's another source of hope, because we don't have to go out and look for answers. They're there.
And could you do what we need to do in a nutshell?
Well, our report is specifically targeted to public health. So our feeling is that if we don't get our own people, our own profession, to understand this issue and understand what they can do about it, and then become in effect ambassadors or multipliers working in communities, if we can't convince public health people about this, we're not going to convince the rest of the world. So in terms of public health, we're saying this needs to be a core part of the curriculum, just as social determinants have become part of the curriculum. Fine, expand that part of the curriculum and make it eco-social, and that's another key message too, in fact, is that it's not ecological over here and social over here. They completely interact, completely. And so we need to take an eco-social approach that understands how those two interact with each other and how they affect each other, and then how that affects the health of the population. So there's a lot of stuff that has to be done around that. I was talking the other day to someone from the Faculty of Public Health Medicine. They could change the credentialing system. You shouldn't get a credential in public health if you haven't passed an exam that includes and had a course of training and had a set of competencies that includes ecological determinants of health as part of the determinants. So there's a lot of things we can do there. We need to be reporting on it. No public health reporting this day and age should come out without a section on the status of the ecological determinants of health in that country or that state or that community. And we should be talking about what are the indicators, the early warning indicators of health problems that we can relate back to that. We should be looking for those, so that if we begin to see them, we know we've got a problem and we hopefully can respond. So there's a lot of stuff we can do around education and training, reporting. We have public health acts. Public health acts came out of the 19th century experience of having to act against governments sometimes, but then against businesses who were doing harm to people in the Industrial Revolution. Well, we still have the same acts, we still have the same powers. We now need to apply them to the ecological destruction that's going on. So why aren't we using the Public Health Act to regulate the coal industry? Because the coal industry is a major threat to the health of the public. And we should be commissioning an inquiry into the health implications of fossil fuels. The government should be doing that. Or the public health officer, the chief state health officer, should be initiating an inquiry into the health implications of energy systems, or the public health impacts of coal, or whatever it may be. So we've got a lot of powers we already have, we just don't use them in the right way yet.
And where's the resistance mostly to doing that?
Well, gosh, there's resistance, of course, from governments and industry who are kind of living in the 19th century, actually. They still think that the answer to our problems is growth, economic growth, in the old-fashioned way. They're still tied into GDP. I talked this morning about GDP. It was never intended as a measure of social progress. If you go back and look at Kuznets, who was the guy who largely developed the GDP system in the 1930s in the US, he actually cautioned the US Congress that we shouldn't use the GDP to measure social progress or social well-being. He was ignored. And it's become that. It doesn't actually reflect social well-being. A very good example is the entire economic activity of the tobacco industry contributes to GDP, including all of the health costs that we incur to treat people with tobacco-related diseases, all adds to GDP. So if you really want to grow GDP, sell more tobacco and get more people sick. I mean, it's a stupid way to measure progress. So we need to change the way we measure progress. So part of the resistance comes from people in our governments, in your government here in Australia, in our government in Canada, and governments around the world, in corporations, who are still wedded to this 19th century notion and still don't understand what GDP is.
And in fact, contraction is what we need.
Well, we do, but I mean, partly we have to rethink that. So when you say contraction, I would say that growing our GDP will lead to a contraction of our well-being. So
Yeah,
what we need is an expansion of our well-being, and we need to measure our progress in terms of what we should be growing as people, if you like. We're growing human development, we're growing human progress, and we can be a lot healthier in a more sustainable society. There's all sorts of what we call health co-benefits of sustainability. So a very good example is a low-meat diet or a vegetarian diet, particularly a low-meat diet, because a lot of people aren't quite ready to go to vegetarian. But a low-meat diet is much less energy intensive, requires much less land to grow it, requires far fewer inputs, and it has health benefits in terms of chronic disease prevention. So it's a win-win. If we go to a low-meat diet, we help the environment and we help health. And there's many other examples in transportation, in energy, in urban design. Lots of those areas where, generally speaking, anything that's good for the environment is good for us.
One last question, because everybody's going to start moving towards the next session. But what's the thing you've done that you're most proud of in terms of either responding yourself to the ecological demands or in your work in theory?
Well, there's several. One of the things I've learned about myself is I'm a starter, but I'm not a maintainer. So I've been involved in starting various things. So back in the 1980s, I helped to start the Canadian Green Party, and I was the first leader. I'm proud of that, even though I'm not involved now in ecological politics, in green politics. I stepped away from that in the late 80s to do other things. I'm proud of having helped to start the whole Healthy Cities movement. And you know, healthy cities, it's not just healthy, it's healthy and sustainable. And I've always seen the two as completely intersecting and written a lot about that. I helped found the Canadian Association of Physicians for the Environment, which is an important advocacy group and social movement, if you like. The Canadian Coalition for Green Healthcare, I helped to launch that. So I'm not involved in any of them any longer. I'm on to the next thing, which in this case is the work with CPHA.
And what about personally? What have you done? Changed your diet? Done something different? Not sold off your house? But
yeah,
anything?
Well, I mean, we try to live a reasonably low lifestyle. I don't bike. I don't bike for the simple reason that in North America I don't think it's very safe. I've had a friend killed and several friends injured biking. And I look at that and I think that's not for me. If we develop the systems that make it possible, and that's happening, then fine. But I drive a small car and a fuel-efficient car. I try not to eat too high up the food chain. I think you don't have to be absolute and fanatical about it. And in fact, if you are, that actually is, I think, a damaging message, because most people are not going to be fanatical and absolute. It's small changes and gradual changes. So I do what I can do, and that's the best I can do.
Thank you very much. You've got quite rock star status here, so it was very kind of you to stop and talk.
That's nice to know.